So the Critical Care Committee started at the very beginning of the pandemic. And at the time, we realized that there was a need to define the impact that COVID-19 was having in our critical care units and understand what we could do to respond to that challenge.
We started to see that there was an opportunity for us to organize and to help all TeamHealth clinicians in terms of getting them familiar with managing patients in the critical care setting, because as you know, the critical care got overwhelmed very, very quickly and was looking for help from all different corners of the House of Medicine.
So the committee and the resources that came together, they brought together the leading thought experts in the company.
The initial core group of 5 or 6 people over time has expanded. We've tried to include all of the ICU directors from all of our 15 programs.
They started to respond to questions and inquiries from the field, and that resulted in them creating white papers and educational sessions on how to manage COVID-19.
Suddenly we had these ICU experts who could offer a variety of comments on what was truly a respiratory pandemic. And so having that expertise was invaluable.
Not only were we had our ears to the ground in terms of news being produced in COVID-19 from our colleagues outside the United States, where their phase, I think, was a little earlier than ours, but we also were collecting information from different practices who had devised different means of addressing problems with COVID-19.
It became a really important part of the early stages of the pandemic, but evolved throughout the pandemic to really become a standalone committee that's really helping us drive and improve the care of critical care throughout the company.
Critical Care Committee and the pandemic has led to a lot of growth in the interest of ICU for TeamHealth. Not only because of the new resources and our ability to stand up and support programs and be helpful, but also the fact that the value add has been demonstrated repetitively across the country.
We are experiencing such rapid growth in our critical care service line. That makes the future work of this committee more impactful than ever. Our goals are always going to focus on quality and patient safety, creating best practices and resources that allow us to continue to drive down ICU mortality rates, ventilator days, and improve sepsis outcomes, to reduce hospital-acquired conditions and improve ICU length of stay. Another very important focus of their work relates to clinician wellness and support. We want our intensivists to have the best possible resources to support their wellness, to support their growth and development as clinicians and as leaders. Beyond preventing burnout, we will continue to create opportunities for our intensivists to thrive.